And today is a big day, not just because it's the new year, it's also a big day for the Affordable Care Act, commonly known as Obamacare. Joining me from D.C. to tell us about it is the Wall Street Journal's health policy editor, Janet Adamy, who's covered the law since it was written in 2009. Janet, why is today so important?
Well, starting at 12:01 a.m. this morning, January 1st, 2014, most of the health care law takes effect. Now, what this means is that for the 49 million Americans who yesterday didn't have health insurance, they now have a range of new ways that they can get it.
That's an incredible number. Janet, stay with us. Coming up next, we'll unpack what this...
Welcome to a new America under the health care law. I'll cut through the politics to show you through your own eyes how the health care law affects you. Ready? It doesn't matter if you're rich or poor, single or married. There's a good chance the law affects how you'll get health care. Let's start with the people who feel the biggest change, those who didn't have insurance yesterday but do now. You might be an American who was uninsured yesterday. Maybe you're unemployed. Maybe you work as a cashier or at a creative job. Perhaps in manual labor or as a bike messenger. Or maybe you wait tables in a restaurant. Keep taking that table's order and I'll explain how the government is now probably offering you health insurance. For the poorest uninsured in some states, Medicaid has been expanded. If you weren't eligible for the government's insurance program yesterday, but if you're single and make less than $16,000 a year, you're now part of the program today. Higher earners may get a tax credit from the government toward the cost of insurance. Almost anyone who chooses to remain uninsured will face a penalty. You are one of these newly insured today if you picked your plan sometime in the last 3 months. You chose it on an online exchange for your state that may have looked something like this. These exchanges show the cost of plans in your area, ratings for the level of coverage, and how much the government's going to chip in. But not everyone gets their insurance on their own. Many people get theirs through their employers. Businesses with fewer than 50 full-time employees are not required to offer insurance under the law. Beginning in 2015, businesses with 50 or more staff will be required to offer insurance to their full-time employees or face a penalty. Some of the smaller ones will have the option of using those same state exchanges you just saw. But some businesses may find ways to avoid having these workers counted as full-time.
We need to talk about your hours.
Many businesses had already been offering coverage to workers on their own. You may have already seen some changes, in fact, to your own company plan, like being allowed to keep your children covered up to their 26th birthday. But you may also see increased costs for your insurance plans as employers face fees. Those fees will pay for expanded coverage offered elsewhere in the law. And you may get some incentives to participate in wellness programs. Another area where things may change for you now, as they will for everyone, is what coverage the plans are required to offer. All plans are now required to offer a minimum range of coverage, starting with preventative health services with no out-of-pocket cost, like the ones you'd get at this doctor's office. More Americans will need a primary care doctor, which could put those kinds of services in short supply. Certain mental health services are also now covered. And now plans are required to cover you even if something serious happens. Insurance companies can no longer cap what they pay after procedures like the one you're having right now. And your rates can't go up following a serious injury or health problem. And that's how the overhaul affects you. Many have tried to guess what the broader impact will be. We're going to have to wait and see how it develops to know for sure.